be the first to admit that many autoimmune diseases do not have an identifiable cause. We do not know medically and scientifically what causes them. But there are some indicators that we think we understand. We think that genetics and genes play into a person's baseline risk for autoimmune disease. And unfortunately, these are things that we can't change. This is just what we're given from mom and dad. But we know that, for example, in spondyloarthropathies, a kind of arthritis, the HLA-B27 is a gene that predisposes people to this disease. Now, that doesn't mean that everyone who has HLA-B27 will have a spondyloarthropathy or this special kind of arthritis, but we do know that people with this gene are more likely to have it. The same thing for PTPN22 and several other autoimmune diseases, including diabetes and rheumatoid arthritis and some of these other things. So we're slowly, as we do the Human Genome Project and other research, we're slowly identifying genes that predispose people to developing this. But we know that since everyone who has these genes doesn't develop the disease, that likely there are other things going on in the environment, exposures to things like viruses, bacteria. We think that sometimes there are protected parts of the body that the immune system doesn't see, like the central nervous system, and that if you have trauma that exposes the body to large parts of the central nervous system, like if you have a head trauma or if you have a surgery on the spine or something like that, and all of a sudden your body sees these antigen or parts of yourself that it doesn't normally see, that it doesn't normally interact with, that might contribute to developing autoimmune disease. Finally, treatments. So treatments, again, because they affect so many different organs and the diseases are so different, they're disease specific. There are some treatments you'd use in MS that you wouldn't use in rheumatoid arthritis, but I tried to break down the commonalities. So you might try surgical or chemical removal of the affected organ. So for example, if you have ulcerative colitis, which is inflammation of the colon, you might cut the colon out and be done with it, and you might never have symptoms again. Or if you have Graves' disease, which is inflammation in the thyroid, you might give radioactive iodine and destroy the thyroid and then just let people be on thyroid hormone. But at least then they wouldn't have high thyroid from this autoimmune process. You might try replacing what's lost. So for example, in diabetes, we give insulin because the beta cells are destroyed. You might try to modulate the immune system. So you might use things like ibuprofen or naproxen to decrease inflammation. You might use steroids like prednisone or methylprednisolone, like in rheumatoid arthritis, MS, and lupus, to try to suppress the inflammation. You might try immune suppressants that we use often in organ transplantation, like mycophenolate or others. Or you might try these new drugs like monoclonal antibodies. And there are a lot of them. So there's ones in psoriasis and rheumatoid arthritis and Crohn's. And there are probably about 18 on the market right now. And the only thing about them is they're very expensive. Or there might be other immunomodulators. So you can see that there are commonalities, but each disease has its own specific treatments that subspecialists would prescribe. So in summary, autoimmune diseases can affect any organ of the body. They can be common like diabetes, or they can be rare like NMDA receptor encephalitis. We don't know the cause of most of them, but we think it's genes mixed with environmental things that cause them. Treatments depend on the disease. It might include medicines, surgeries, or other things like that. There are no screening tests for these diseases for healthy people, but people with symptoms, if their doctor has a high suspicion of the disease, can have specific testing for that disease.
We're just now kind of beginning to do a lot of research. One of the areas is diet. And most of you have probably heard of omega-3 fatty acids. That's another area that's really promising for reducing inflammation in the body. So specifically the fatty acids EPA and DHA. That's one of the reasons why we recommend 3 servings of fish a week. Most of us can't really do that, or don't, like in this area, the fish isn't as plentiful. So that's fatty fish that we're talking about, like salmon and sardines. So you might want to consider taking a fish oil supplement. So you want to eat a variety of fruits and vegetables, and then also opt for more plant-based proteins like beans and nuts, seeds, because they're finding the foods that inflame our body are more, of course, animal-based with the saturated fat, and then our processed foods are really with the trans fats. They think that that is why maybe the inflammatory diseases are on the rise, because so much of us are eating the fast, quick foods, frozen TV dinners. 2 generations ago, cooking meals used to be just synonymous with providing food and eating. And now it's, a lot of us don't cook anymore. So eating whole foods, shopping around the perimeter of the grocery, looking at what you're eating. Does this look like food or is it something else, out of a box or can? Think about whether your grandma would consider it to be food.